Good morning, everybody. Aloha. I want to thank Representatives Chu, Lee, two of my friends from the U.S. House. I served with them back when, and we're still fighting the good fight. And the Congressional Black and Hispanic Caucuses, and to all of the organizations that have worked on this bill, which is very comprehensive. If you've seen the bill, it's 1,800 pages long. So healthcare is a fundamental right. I consider it a right, not a privilege, which is why Democrats fight to make sure everyone can get the care they need in our country. I was in the House and one of the committees of jurisdiction when we passed the Affordable Care Act. And that took a lot of doing because there were people protesting. There were a lot of people who were totally against the passage of the ACA. And that was a historic legislation which expanded healthcare access to tens of millions of Americans and lowered costs for millions more. And under President Biden, we passed the Inflation Reduction Act, which lowered healthcare costs for millions of older Americans on Medicare, capping prescription drug costs at $2,000 a year. Again, massively important to the millions of seniors who are on Medicare. But too often, the healthcare needs of underserved communities, our AA and HPI communities, are not truly met. Our communities have higher rates of diseases such as hepatitis B and tuberculosis, and often face cultural and language barriers in getting the healthcare we need. People of color and other marginalized groups face unique health challenges that require targeted solutions. And that is why today we are proud to reintroduce the Health Equity and Accountability Act, HEAA, a bill first introduced in 2003 by our friend, the late Congressman Elijah Cummings. This bill is massive, nearly 1,800 pages, and covers everything from data collection and culturally competent care, to research for diseases like diabetes and HIV, and so much more. It lays the groundwork for a country in which the healthcare needs of all Americans are better met by better understanding and directly targeting the challenges our communities face. But as we work to strengthen healthcare for every American, Republicans want to make it even harder for us to access the care that we need. Not only have Republicans tried to eliminate the ACA dozens of times, I think we all remember one of the last times when John McCain cast the decisive vote to prevent the ACA from being repealed that time. So, the Republicans are not on the same page as we are on wanting healthcare to be accessible to all. In fact, their new roadmap, Project 2025, weakens Medicaid, restricts critical medical research at the NIH reinstates Trump-era policies, negative policies, and much more. And as they try to drag our country backwards, we will continue pushing forward to ensure everyone in our country has access to health care. So thank you. And now I'd like to introduce HEAA's House Lead, my friend, Congresswoman Barbara Lee. Barbara.
Thank you very much. Thank you, Senator Hirono, very much for your tremendous leadership. And you can see through her leadership, this is bicameral. And
Yes.
It's so important to have the Senate on the same page as the House, because that's how we're going to get this finally passed and signed into law. And I'm so proud of our chair, Judy Chu, who has stayed the course.
We all have stayed the course.
It's been really
20 years.
20.
I know.
And as I think about this, we actually were able, because of HEAA, to include some provisions in the Affordable Care Act.
Yes.
When it was passed. And also, is Nanette Barragan here. I wanted to thank the Hispanic Caucus and, of course, the Congressional Black Caucus, chaired by Congressman Steve Horsford, our chair, but also who's going to speak on behalf of the CBC, Congresswoman, Dr. Robin Kelly, who's been the CBC lead on HEAA for many, many years. This is a visionary bill, and it's really brought the Tri-Caucus together. It's now CAPAC's turn, as you heard, to introduce the bill. And so, as a proud co-chair of the Congressional Asian Pacific American Caucus, I'm also a member of the Congressional Black Caucus, and I'm very proud to lead the reintroduction of Health Equity and Accountability Act. That's what HEAA stands for. Updating the Health Equity and Accountability Act. It's been a long process that would not have been possible without the expertise of so many of you here today. And we're so grateful for the APIA Health Forum and the Association of Asian Pacific Community Health Organizations for their tireless work in leading the community working groups. This is a very democratic process as it relates to the inclusion of so many real points of views and expertise into this bill. Also, I'm grateful for all of our community partners for their leadership in this critical effort to make our communities healthier. That's what this is about. HEAA is a bold and comprehensive vision for addressing racial health disparities and improving health outcomes in communities of color and the underserved. It's the only legislation that directly addresses the intersections of health inequities and race and ethnicity. Racial disparities in healthcare are persistent and unacceptable. Diseases such as diabetes, HIV, heart disease, and long COVID and COVID continue to disproportionately affect African Americans, Asian Americans, Pacific Islanders, Native Hawaiians, Latino populations, and Native American populations. And despite gains made under the Affordable Care Act, Latinos, African Americans, and certain AA and NHPI communities are still at higher risk of being also uninsured. Right now, extremism and disinformation are running rampant in our country. The Republican majority is working hard to enact their extreme Project 2025 agenda, which would delete the word equity from every federal rule and regulation and every piece of legislation that exists. Equity, making it nearly impossible to address the health and well-being of underserved communities. Project 2025 allies have made it clear, if given the chance, they will make America dangerous and dystopian reality for communities of color, repeal federal health care protections for marginalized communities, and gut Medicaid. It sabotages science-based policies that address climate change, abortion, health access, and education, laying the groundwork to guarantee deadly health outcomes for communities that our caucuses represent. That's why it's more important now than ever to get HEAA passed and enacted systematically to improve healthcare, to ensure that all Americans, no matter their race, ethnicity, gender identity, sexual orientation, age, or language background, can stay healthy. As I've often said, equity, especially health equity, is not an add-on or an extra. It's central to the mission of the Biden-Harris administration and Democrats in Congress. We need to pass HEAA to address the underlying challenges that prevent communities of color and underserved communities from gaining coverage and accessing high-quality, affordable health care. We need to pass HEAA to improve the diversity and quality of our country's healthcare workforce, including addressing the physician shortage and diversity issues. We need to pass HEAA to ensure that all federal healthcare data is disaggregated, which our chair constantly hammers us on, because it's so important so that we can better understand the inequities faced by all people of color. And we need to pass HEAA because it's diametrically, mind you, diametrically opposed to Project 2025. Finally, let me just say it's a critical step towards ensuring that all Americans have the resources and care that they need, not just to survive, but to thrive. With the help and the health of our advocates and partners, I know that Congress can act and create a truly healthcare system for all. And someone who has just been such a tremendous leader in this issue and so many other issues in terms of equity and justice is CAPAC's fearless leader. I call her our woman warrior, Chairwoman Judy Chu.
Thank you, Barbara. All right, Judy.
Well, thank you. I'm Congressmember Judy Chu, and as chair of the Congressional Asian Pacific American Caucus, or CAPAC, I'm so glad to be here with my colleagues, CAPAC Healthcare Task Force Co-Chair, Congressmember Barbara Lee, and CAPAC Executive Member Senator Mazie Hirono, along with Congressmember Robin Kelly of the Congressional Black Caucus, as we roll out the Health, Equity, and Accountability Act. I want to especially thank the lead organizations of the Community Working Group, Asian and Pacific Islander American Health Forum, and the Association of Asian Pacific Community Health Organizations, who put so much work into developing and to helping in advancing this bill alongside CAPAC. Reducing health disparities within communities of color is not just an Asian American, Native Hawaiian, and Pacific Islander issue, or an African American issue, or a Latino issue. It's an American issue, one that impacts all of our collective communities. That's why for 2 decades, the one bill that the Congressional Tri-Caucus has taken turns each Congress to introduce is this bill to ensure that our communities have access to quality, affordable health care. Asian American, Native Hawaiian, and Pacific Islander or AANHPI communities, like other populations, are disproportionately impacted by a number of health disparities. For example, Asian Americans, who comprise about 7% of the US population, experience about 60% of the chronic hepatitis B burden. Or how about Native Hawaiian and Pacific Islander communities, who are more than twice as likely as white people to die from diabetes? These disparities are a result of factors like higher uninsured rates, language and cultural barriers to pollution that lock communities of color out of quality care. Language access is particularly significant as an issue for the AANHPI community, with more than a third of AANHPIs having limited English proficiency. And in fact, in my hometown of Monterey Park, 73% of households speak a language other than English. That's why the Health, Equity, and Accountability Act, or HEAA, is so critical. Among other proposals, this comprehensive bill would advance culturally and linguistically appropriate healthcare, promote healthcare workforce diversity, and address social determinants of health. It would create a healthcare system that works for all Americans, no matter their race, ethnicity, gender, or language ability. Over the years, HEAA has secured transformative victories for millions of Americans. It ensured key provisions on disaggregated data collection and language access that were included in the Affordable Care Act, so that we could better understand the needs of underrepresented and underserved populations. It was critical in the fight to finally require states to provide Medicaid coverage for Pacific Islanders from the Marshall Islands, Palau, and the Federated States of Micronesia living in the U.S. And it helped to codify the Office of Minority Health within the Department of Health and Human Services. So it's clear we have to continue to push for life-saving solutions through HEAA and build upon our wins in every Congress. There's so much work left to be done, including resources that bolster mental health to improving access to care for immigrants and their families. And we have to defend ourselves against Project 2025, which would gut the Affordable Care Act, resulting in the loss of coverage for millions of Americans, and it would repeal life-saving provisions in the Inflation Reduction Act, such as a $35 insulin cap and the lower drug costs for seniors. So I proudly join my CAPAC colleagues in introducing HEAA as the Tri-Caucus's ongoing blueprint to make health equity a reality for all. With all of you here today, we will ensure our community's needs are meaningfully addressed, boldly advanced, and fully protected. And now I would like to turn the podium over to an incredible champion for health equity. In fact, she's taken the lead for this bill every time, as she is chair of the CBC Health Brain Trust, and that is Congressmember Robin Kelly.
Thank you so much, Chair Chu. It's good to be here with my partners in health. When I became chair of the Congressional Black Caucus about 8, maybe 9 years ago, and they presented me with HEAA and said it was my turn, and I was so new, seeing all those pages scared the you-know-what out of me. But as you've heard already, this bill will address, it doesn't matter where you live, what your zip code is, what your race is, what your gender is, and what your language you speak, that we're taking care of everybody. You can say it's like the diversity, equity, and inclusion bill of health. And even though we've made progress, we have so much more to go. When I think about all the work I do around maternal mortality and morbidity, and the United States, the richest country, and we don't rank very well in that vein. And if we could pass this bill where everyone gets the healthcare attention and access that we need, it would make a huge, huge difference. And when I think about even gun violence as a public health crisis, what this bill could do with that. When I think about mental health, as someone that has a master's in counseling, how we could help so many people if we pass this bill. So I'm proud to stand here again. I don't know how many Congresses it's been, but I'm proud to be here. My sleeves will be rolled up, ready to help get this bill passed. We need it. And as you've heard my colleagues say, we cannot mess around with Trump's 2025. Because all the progress that we have made, he wants to roll back. And we cannot afford to have that in the United States. So thank you. And with that, I introduce.
Did I keep interrupting? I just got you, but you able to introduce those, right?
And with that, I'd like to introduce Adam, and I hope I don't butcher your last name, Parbolito. Parbolito, Director of Policy and Advocacy, the Asian Association of Asian Pacific Community Health Organizations. Thank you so much.
Thank you so much, Congresswoman and Senator. Good morning, everyone, or as we say in my home island of Guam, Hafide and with Manana. I'm Adam Carbolito, and on behalf of the Association of Asian Pacific Community Health Organizations, or APTRO for short, I'm proud to be here this morning to endorse the Health Equity and Accountability Act. APTRO is a national nonprofit association of community-based healthcare organizations, mostly community health centers, that works to improve health access and outcomes for medically underserved Asian Americans, Native Hawaiians, and Pacific Islanders. Each day, our member community health centers provide care to nearly 750,000 patients, most of whom are low income, racially and ethnically diverse, and who are most comfortable speaking a language other than English. Unfortunately, for many Asian Americans, Native Hawaiians, and Pacific Islanders, and other communities of color, health disparities and difficulties accessing and navigating the healthcare system are regrettably facts of life. Our communities are consistently underrepresented, or worse, completely invisible in health data and research. Community members are often unable to communicate with their doctors or nurse in a language they can understand. We have challenges accessing services for reproductive health, mental health, substance misuse, or diseases like hepatitis B, tuberculosis, diabetes, heart disease, obesity, that disproportionately affect our communities. Many are unable to get insurance because of their immigration status, or unable to afford insurance. And many AA and NHPI sit at the intersection of not just being a person of color, but also a woman, an LGBTQ individual, a person with a disability, or a resident of rural America, a U.S. territory, or a socioeconomically diverse community. Our communities, like so many others, are in dire need of help, and Congress has a responsibility to act. Thankfully, HEAA puts forward a bright vision that addresses these and other inequities experienced by all those who are underserved and marginalized. It builds on the extraordinary progress that we made with the passage of the Affordable Care Act and its successive legislation since, but there's still much more work to be done. HEAA ensures that all communities are represented in federal data, supports language access and cultural humility, promotes a diverse health workforce, including allied health professionals and community health workers, improves access and quality in healthcare, supports women, gender-diverse people, children, and families, addresses mental health and substance misuse, addresses high-impact minority diseases, improves IT infrastructure and accountability and evaluation in healthcare, and it addresses the social drivers of health, including improving environmental justice. Just last week, I was back home in my island of Guam, as well as in the Commonwealth of the Northern Mariana Islands, communities that are part of the American family, but who are often ignored and overlooked in the U.S. healthcare system. We visited healthcare facilities that are in dire need of infrastructure and IT improvements. They need resources to hire, train, and keep their health workforce. They have shortages of prescription drugs and life-saving medical equipment. But we also saw dedicated and hardworking professionals who give tirelessly of themselves to care for their patients, and patients and families who continue to hope that the system will work for them. While the challenges in addressing and maintaining healthcare are significantly exacerbated in these island communities, the issues are all too familiar in communities that are underserved across the country. HEAA recognizes that there is no one-size-fits-all or single solution to fix the gross inequities in our healthcare system. The vision put forward by the Tri-Caucus is comprehensive and visionary and will make a real difference to patients and their families and the healthcare professionals who serve them. So today I want to thank Senator Hirono, Congresswoman Lee, Chairwoman Chu, Congresswoman Kelly, and all the members of the Tri-Caucus for their unwavering and consistent leadership to address health inequities and disparities across the nation. I also want to thank our partners, the Asian and Pacific Islander American Health Forum, and the broad coalition of patient, provider, disease, and civil rights groups who contributed to this bill. APCHO and our member community health centers are proud to endorse HEAA, and we look forward to our continued partnership to reject any effort to erode the progress that we have made and instead advance this vision of health equity for all. So thank you, Ms. Mazie, and I'll turn it over to my community.
I don't want to take it.
Oh, yeah. Yeah.
Thanks.
Yeah, and I'd like to turn it over to my community working group co-lead, Judy Chu with the Asian Pacific Islander American Caucus.
Good morning, all. I stand before you as the proud daughter of South Korean immigrants. I am so honored and humbled to stand here with you, with our fierce leaders on Capitol Hill. Our sincere thanks to Senator Mazie Hirono, Congresswoman Barbara Lee, the Congressional Asian Pacific American Caucus Chair Judy Chu, and of course Dr. Robin Kelly of the Congressional Black Caucus. As we've discussed this morning, this is the first time the Health Equity and Accountability Act is being concurrently introduced by both chambers of Congress. Thank you to the endearing, the stewardship, leadership of the Tri-Caucus, the Congressional Asian Pacific American Caucus, the Congressional Hispanic Caucus, and the Congressional Black Caucus, for bringing collective power to underserved and underrepresented communities. Thanks to all of you, we know as a community we have a voice and a platform to advocate for our families, their well-being, their safety, their future on this national level. I also want to acknowledge our terrific community partner organization, Adam from APCHO, and so many other community leadership organizations here with us today, including the National Minority Equality Forum and Access. As many of you know, HEAA is celebrating its 11th iteration since it was first introduced in 2003 by the late Congressman Elijah Cummings from the great state of Maryland. The Health Forum has been an incredibly proud partner to have been part of the HEAA family and to be CAPAC's counterpoint in 2011, 2018, and of course today. HEAA is a monumental piece of legislation. As we like to say at the Health Forum, this is the blueprint for health equity and health justice in our nation. It starts with the understanding that uplifting all of our communities requires listening to our communities and centering community voice. It incorporates feedback from over 300 grassroots organizations, civil rights organizations, and health justice leaders. These organizations ensure that we have true representation and that the legislation reflects that exactly. Our advocates represent people of color, LGBTQIA individuals, seniors, women, mothers, babies, immigrants, individuals with disabilities, chronic diseases, and so many more. He advances justice and health with 10 titles spanning over 1,700 pages, and I invite you to at least read a portion of it. He is ever evolving to address the diverse and challenging needs in our communities. It confronts the health disparities that result in unequal outcomes head on. It proposes bold remedies to address underrepresentation and the institutionalized bias, racism, and discrimination within our healthcare system. It ensures that our community's well-being will no longer be determined by who you are, where you're from, what civil by turning down barriers that prevent our communities from accessing healthcare. HEAA offers a roadmap for policymakers that truly value the well-being of all Americans and ultimately envisions a bold future where healthcare is not a privilege but a right. Thank you.
Okay, we're now going to hear from Brandon Garrett. He's the COO and Chief of Staff, National Minority Quality Forum. Okay, this is the kind of situation where everything has been said, but not by everyone.
Right. I won't take.
Go for it.
Yeah, thank you so much. I won't take up too much of your time. One thing I remember when I started was Congressman Kelly. She was there at one point, and I think when we took HEAA over, it was 13 pages. So we advanced 500 pages. Additionally, I'm from New Orleans, so I apologize for the heat. But the National Minority Quality Forum is pleased to endorse the Health Equity and Accountability Act of 2024. NMQF is a 501c3 research and advocacy organization that's committed to the transformation of America's legacy healthcare finance, research, and delivery constructs to a system that embraces as its prime directive the prevention and reduction of patient risk, the assurance of optimal care, and outcomes for all. We are proud to be a leading partner with Congresswoman Barbara Lee, Senator Hirono, Dr. Chu and Dr. Kelly, and the Congressional Tri-Caucus in their steadfast leadership, bold vision, and unwavering commitment to the creation of a nation which health equity is a reality. NMQF is a research and data organization, so we're particularly proud of our continuing work on Title IX, the accountability and evaluation which ensures the federal government is responsive to and held accountable for the efforts to reduce health inequities and disparities by expanding civil rights protections for anyone operating with federal financial assistance, ensuring that all populations have access to quality health care. So thank you all for being here. Apologize for the heat, but thanks for everything.
Thank you for all of you here. Obviously, we've been working on this for a long time, and there have been provisions of HEAA that have been included in other bills that we've worked on because the goal is to have these individual provisions as we can to find vehicles so that we can push for various aspects of this bill. But this is a compilation of a lot of hard work from so many people. Do any of you have any questions? Okay, read the bill. Thank you very much. And by the way, I just want to add that, healthcare is real. The lack of access is real. And I do want to mention I'm the only immigrant serving in the United States Senate. And I came here as a poor immigrant. My mother had no health care. And believe me, growing up, if my mother got sick, she would not be able to go to work. And she obviously had no health care. And it meant a lot to us that there are all of these disparities that were never addressed back then. And that's why we're working so hard to make sure that people in our country get health care. Thank you.